Welcome to another EduMed video, and in this video we'll be talking about Remdesivir. This is a broad-spectrum antiviral medication that was produced by a combination of Gilead Pharmaceuticals and the American military. It was produced back in 2014 as a potential treatment for Ebola and Marburg virus, but has found utility in other viruses and is considered a broad-spectrum antiviral medication. In this particular video, we'll be going through what exactly Remdesivir is, what its mechanisms of action are, talking a little bit about the resistance that's been seen in animal models, and then talking a little bit about the adverse effects, which I think is important to bear in mind given that this is a new drug and potentially might be making its way into clinical practice, especially since the Americans have recently suggested that it might be available to all patients with COVID-19. So what exactly is Remdesivir? The best way to describe it is as a broad-spectrum antiviral medication, and it's easy to think of it as similar to that of the broad-spectrum antibiotics. It doesn't target a specific virus, but instead targets quite a generic pathway in the viral replication. And so it can be used for different viruses, and that's why it's been looked at as a potential drug for treatment of COVID-19. It is a nucleotide analog, and it specifically affects adenosine. And what it does is it prematurely terminates viral replication, and by doing so, theoretically reduces the viral burden and reduces the time that it takes to clear the virus. Now, to go through the different mechanisms of how Remdesivir works, it's worth looking at this infographic that was produced by microbenotes.com, which is a great website that I'd really recommend you go and have a look at. There's a lot of different useful information, not just about COVID, but also other diseases as well. So the first thing to say about Remdesivir is that it is a prodrug. It gets metabolized into its active compound, which is GS441524. And that is the active molecule intracellularly that causes disruption in viral replication and therefore has its antiviral effect. As with most drugs, the reason that you have to have a prodrug is that it needs to get to the right place. And so Remdesivir itself can then move into the intracellular space, and then it gets metabolized, and the GS441524 isn't then able to extrude back out of the cell. Now, let's consider SARS-CoV-2 infection. Imagine this is the plasma membrane of a respiratory cell. So the SARS-CoV-2 virus comes along, and then it binds to the ACE2 receptor, which is expressed on the surface of the respiratory cells, as with many other cells in the body. When it binds to that receptor, the virus then gets invaginated into the plasma membrane and then gets enveloped into the cell. So the virus makes its way intracellularly, and that's where it starts to do damage. And the first thing that it does is it produces a viral polymerase protein. And this viral polymerase protein is the thing that will then read the RNA inside the virus and replicate it. So it's very much like a photocopier. It'll just photocopy all of the virus, and then that virus RNA produces the protein coating for it. And then once the cell gets filled with lots of viral protein and viral RNA, then the cell itself bursts, and then it moves out and infects other cells. And that is very simply how most viruses work. But what Remdesivir, and specifically the active compound of that GS441524 does, is that once this viral polymerase protein is produced, it binds to it. And it binds to the receptor portion of it, which you can see here on the 3D image. And by doing so, it stops the viral RNA from being read by the ribosome, by the polymerase protein, and then producing more. So it stops that photocopying. So by reducing the amount of replication of the viral RNA, you're going to reduce the total viral burden inside the cell, and therefore hopefully allow time for the innate immunity of the patient to get rid of the infected cells. Now, there is some evidence that you get some resistance with a remdesivir. Now, the active compound GS441524 has two main activities. Firstly, it'll interfere with RNA-dependent RNA polymerase, like we showed in the infographic above. But it also evades the proofreading that's done by the exoribonuclease. Exoribonuclease essentially just checks the photocopy and makes sure there are not big differences between the viral RNA that's being read and the one that's being produced by the polymerase RNA enzyme. And so if there is a difference, then it says, aha, there's a difference, and then goes back and tries to fix it. But by evading that proofreading as well, you're going to make sure that you get junk RNA that's produced and not one that replicates the viral RNA. It is important, however, to note that this termination of the viral RNA polymerase is delayed by about 5 base pairs. So, if you're getting to the end of the photocopying of that viral RNA and you're only, say, 4 base pairs from finishing it, when the active compound GS441524 comes along and binds to the viral RNA polymerase, it may not have bound quick enough to stop that viral RNA from being completed. So it doesn't completely stop all viral RNA replication, but it will reduce it by hopefully getting there early enough to stop most of the viral RNA from being photocopied or reproduced. Now, it should be noted that in mouse models with mouse hepatitis, the mouse hepatitis viral polymerase seems to show partial resistance, so it doesn't seem to be stopped as well with remdesivir as with other drugs in the in vitro and in vivo mouse models. Now, that might be that there's an actual mutation that stops the binding of the active compound of remdesivir, or it might be that the mouse or the cells themselves lack the thing to actually convert the prodrug of remdesivir into the active GS441524. It's unclear at this point, and whether there's actual resistance in humans is again not been elucidated yet. But it's worth considering because not all patients potentially are going to have full effect from remdesivir, at least based on the early animal work. The final thing that's worth thinking a little bit about is the adverse effects. Now, it's difficult because there hasn't been large human trials and we don't have a large amount of long-term data on these patients. And so as such, we need to be careful. If you look through the literature and at some of the phase 1, phase 2 and phase 3 trials that have been done on remdesivir, they describe respiratory failure, hypoalbuminemia, hypokalemia, anemia, thrombocytopenia, hyperbilirubinemia, transaminitis, and QT prolongation. Now, most patients who we're going to be trialling this on with COVID may well present with some of these diseases, especially if they're further on in their disease process. But I think the main utility of remdesivir is potentially going to be to giving it early, similar to how we were giving Tamiflu in the swine flu epidemic. And what we're trying to do is to reduce the amount of viral burden on the patient. And as such, we might be giving it on the wards. So, all of these things may well be just the virus itself, but I think it's important to note that QT prolongation has been seen in these patients. Now, what that indicates to me is that if we are starting these patients on remdesivir, we should get an ECG before we start, and then maybe some serial ECGs afterwards. Now, on intensive care, that's not a problem because that's fairly routine for us, especially if we're on multiple drugs that prolong the QT interval. However, for patients who are on the wards, that may not be as much of a culturally done, and therefore we may need to actually consider doing regular ECGs on these patients, at least a couple, to make sure that there hasn't been a significant prolongation of QT interval, especially if we're giving this in conjunction with other drugs that may prolong QT interval. So overall, remdesivir seems to be a novel way of stopping viral replication, and it seems to have a broad spectrum of activity against various different viruses, and so it's interesting to see what it'll do against COVID, and there's some early promising data. It's important to note that there may be some resistance, and so some of those early studies that showed that there isn't a significant difference, it might be that some patients have a genetic predisposition to having resistance to the remdesivir drug, either through its inability to become the active compound by converting the prodrug, or if it's relating to the actual ribosomal mechanisms inside the cell. Clinical trials are ongoing, and what I'll do is I'm going to, over the next few talks, go through what the evidence for COVID-19 is. And the way I'll do that is by taking each paper in turn and then analysing it as a paper in and of itself. So you'll see quite a few videos over the next couple of days to weeks where we'll dissect each study and talk about the pros, cons, and what potentially it suggests. So if you like this video, please like it, please subscribe to the channel, and if you hit the bell notification, you'll be updated of the next video when it comes out. And like I say, the next few videos are going to all be looking at specific trials, looking at remdesivir in COVID-19. Thank you very much.